Virus here in Connecticut, and there are growing concerns about just how accurate coronavirus tests are. So we are taking a look into that right now. We want to get to those home tests are. A lot of people test negative only to test positive later. Channel 3 Eyewitness News reporter Mike Savino has been talking with doctors about this. He is joining us live from Hartford Hospital. And Mike, what are they telling you?
Well, Aaron, this seems to be a growing problem with Omicron, and it's the at-home tests that are having this issue. Of course, the PCR tests remain more accurate, but with testing in such short supply, people are trying to get whatever test they can get their hands on right now. So what should you do if you think you might be positive, but you test negative?
If you do have symptoms, and that could include a runny nose or flu-like symptoms, then you should get a rapid test.
COVID continues to spread rapidly, and doctors are urging people to get tested at the first sign of infection. This includes using at-home rapid tests if you can't get to a testing clinic. But as we learn more about the Omicron variant, we're seeing more false negatives.
The antigen tests really require a high level of virus in order to test positive. And sometimes it just takes a couple of days for that to really hit the threshold for that test to turn positive.
Doctors say that's because those at-home tests can't always detect Omicron so soon after infection. They need a certain amount of the virus. The PCR tests used at testing clinics aren't showing the same problem.
The PCR, on the other hand, is much more sensitive. It amplifies the virus.
Some experts say saliva tests are more accurate, but at-home saliva tests are expensive and hard to come by. This has led some to do a throat swab with at-home nasal tests. But is this a good idea?
I would follow the directions of the kit. That's how it was studied.
Doctors warn that misusing a test could impact the results. The FDA is also urging people to use those kits as directed. But if you're symptomatic and you test negative, what should you do?
If you've been traveling, you've been exposed to somebody who's positive, your risk goes high. And if individuals are not getting better, usual flu cycle, then they must get tested again.
Testing remains in short supply, but should people wait to get a PCR test if they're better at detecting Omicron?
Really, the answer is whatever test you have available to you.
And of course, one solution would be to increase the supply of both those PCR tests and the at-home testing kits. Coming up on Eyewitness News at 6, I'll tell you what healthcare providers are doing to increase testing. I'll also update things on when President Biden might deliver on his promise to mail home kits nationwide. Live from Hartford, Mike Savino, Channel 3 Eyewitness News.